Well, hello, everybody, and welcome again to our Start or Sit podcast here. I'm Shannon O'Kelley, physical therapist with Dr. Hawkins, sports medicine specialist, orthopedic surgeon. Dr. Hawkins, how are you?
Hey, I'm doing great. I'm doing wonderful. I'm getting excited for Thanksgiving and catching all the games. It's always wonderful to get 3 NFL games on a weekday, so we're excited for it.
Yeah, exactly. Here we go. We're going into week 12. As we talk about Thanksgiving, I've got to reminisce here. I always enjoyed Thanksgiving. Remember John Madden, the turducken or whatever it was, the turkey?
Yeah.
Was that Detroit? Always played Cowboys, didn't they?
Yeah, they usually had that traditional Thanksgiving Day game, and remember he also came out with the one that had 10 or 12 legs attached to it.
Yeah, that's right.
So he could give every offensive lineman a leg.
I like that guy. We miss him, man. He was great. I loved him. Yes, turducken and all the legs, and he was always talking about eating. He really liked those big guys up front, the offensive linemen. That's for sure. Yeah. R.I.P. John Madden. We miss you for sure. Okay, here we go. Justin Fields. Boy, this is a big name guy playing pretty good for the Chicago Bears. Gosh, he's got a non-throwing injury on his shoulder. He sounds like he's day to day. I didn't see the injury. They're talking about him again being day to day. He may miss some time. What do you think? Justin Fields, Chicago Bears quarterback.
Yeah, he's obviously a big part of what they've been trying to develop there, but unfortunately they don't have a lot around him. So his injury, he was scrambling, as he's been doing a lot of this year, and he was going out of bounds, got tackled, and essentially came down directly onto the left shoulder, the non-throwing shoulder. So they've been a little messed up with regards to describing his injury. The actual official report won't be out till today. Initially, somebody reported from the NFL injury that he had dislocated the shoulder, and then subsequently they took that back. So it sounds like and looked like it was probably an AC joint injury based upon how he landed. He didn't have his arm away from his body, so I don't think he actually dislocated it. That being said, the reason they're going day-to-day with him is it's his non-throwing shoulder. And so the expectation is probably if he can tolerate the discomfort of whatever this injury was, they may play him. That being said, he's also the future of their franchise. And I think that he will probably be a sit this week, regardless of the nature of the injury, just because they don't really have a lot to play for at this point. And I would think they'd want his soft tissue injury to heal up.
Yeah, that's an excellent point. He is the franchise what I see, and so yeah, a good call. I think it probably the way you described it, probably an AC joint separation, kind of takes time, non-throwing injury, but because of his future and his role and where they're at, he is going to sit. Okay, Justin Fields most likely will sit this week. Okay, next up is our friend Chase Edmonds. Boy, Denver. They've been struggling. They got beat by the Raiders. I mean, I just don't know what's going on down there, but they need this guy, Chase Edmonds, and he's out with a high ankle sprain. They're saying he's going to miss a lot of time. It must be a significant high ankle sprain. Let's talk about Chase Edmonds.
Yeah, that's the injury we've been hearing a lot of this year. And again, for those who don't follow us regularly, that's where those two bones in the lower leg, the soft tissue, the connective tissue between them has been stretched or torn. And so that takes longer to heal. You usually have to protect that for a while in a boot. And occasionally you need to do surgery on it, as Cooper Kupp is having done had done last week. So he's going to be in a tough situation. They just released Melvin Gordon as a running back from them because he's been fumbling a lot recently. So they're very, very thin at running back, and he will be sitting. He will not be playing this week. I believe he's being put on injured reserve, so that's probably a solid 4 weeks of not playing for him. So, unfortunately, Russell's going to have to, get his legs in gear and probably have to start scrambling more because he's going to be their backup running back.
Yeah, absolutely. So Chase Edmonds is a sit, injured reserve, at least for 4 weeks. High ankle sprain takes significant amount of time depending on the severity of the injury, but those high ankle sprains take a lot more time because of the disruption of the tissue versus a normal lower ankle sprain that we describe. So We've seen a lot of these ankle sprains. We're going to talk about another one here, another high ankle sprain. I mean, Kansas City Chiefs. I mean, Magic Mahomes comes back Monday Night Football, Mexico City. What a game. What a game. I felt bad for the Chargers. I like Justin Herbert. He's an Oregon kid, local. But, man, Mahomes is magic. But he's not going to have a running back here. Clyde Edwards-Helaire is most likely probably going to be out. Let's talk about him.
Yeah, he's again, that same high ankle sprain. He's definitely going to be not playing this coming week. They're lucky in that they have a lot of offensive weapons. So as far as a team goes, they'll be able to work around him. He had, interestingly enough, been playing less, and he had not been performing to the level that they expected. I don't think it's going to affect the Chiefs overall, but if you have him as your running back and you were hoping that he was going to be increasing his productivity, unfortunately, he will be sitting this week.
Yeah, he's out this week, and keep an eye on him because it could be a couple weeks if he, again, we talk about the severity. We grade these ankle sprains. We don't know what this is graded at, but he's at least out for this week. Keep an eye on him. He may be out next week. So he is out. That's Clyde Edwards-Helaire, Kansas City Chiefs running back, is out in week 12. Mike Williams, here's another guy. He's been just kind of struggling to get back in the lineup. Sounds like he had, here we go, previous ankle injury, probably a high ankle sprain. Kind of re-aggravated it. They're talking about maybe he's in, maybe he's out. What do you think about Mike Williams? LA Chargers, wide receiver.
Yeah, he had that really high-energy torsion injury, similar to what Cooper Kupp had, and he was in the situation where they debated surgery and decided not to do it. And this is one of the ones where they might be kicking themselves a little bit. The surgery that Kupp had done is to provide sort of an internal support or an internal brace while that soft tissue between those two bones heals. And unfortunately, you may think it's good, but until you start stressing it, you don't really know, is it 100% or is it 75%, and what the flexibility of that tissue is. So the idea that he came back and re-aggravated it is a sign that scar tissue, the pliability of that tissue, the flexibility of that tissue is probably not great. And so I think he's not going to be able to play. They're lucky they got Keenan Allen back. Mm-hmm. And so I think for Mike, he's going to be a sit for this week, and keep an eye on him because this may be something he's not able to get back to his regular form for the rest of the season.
Yeah, he did this in week 7. His initial injury, the high ankle sprain, was week 7. Here we are looking at, 5 weeks later, and he's still kind of struggling. And so sometimes we talk about biology a lot, the healing process, but with these high ankle sprains, it just sometimes takes time. There's so much soft tissue that's disrupted. The body just needs to heal. Before we move on, just because we've had so many of these, you talk about this surgical intervention and correction or enhanced stabilization procedure. Cooper Kupp, you talked about having it last week. Maybe describe to our listeners, as an orthopedic surgeon, are you using hardware? Are you taking soft tissue? You're basically kind of stabilizing those two bones to connect them again or bring them together so that tissue heals. That's what I understand, but maybe describe that procedure for us.
Yeah. So again, when those two bones are sort of split apart, sort of think of it like a chicken wing, not the drum, but the wing, and it has two bones in it, and there's sort of tissue between them that holds them together. So that's been torn. So it will heal, but you want it to heal anatomically. So you want those bones to be in the correct position as it heals. So for a lot of years, the only way to do that was to actually put a metal screw between those two bones to hold them together. The problem with that is that's a fixed piece of metal, doesn't have any flexibility to it. And so what would happen is that would have to come out, because once the person started to move, you normally have a little bit of pliability between those, and that screw would break and cause potential problems. So what was developed was the ability to actually put essentially a high tension piece of suture between those two bones that's fixed with a small metallic button to either bone on either side. So that's this sort of internal brace, this tightrope device is what they'll call it. And what that does, it holds the bones in the correct distance from each other, but because it's suture, it allows a little bit of flexibility. So again, It's something that can be left in place as you start to rehab and move the person without worrying that there was a metal screw that would then break and be a problem.
Yeah, good point. That high tension suture, is that biodegradable or is this kind of stay there?
Yeah, it's a permanent suture. And again, you can always talk pros and cons. Some people do believe that, if you have something like that in a real high demand athlete, maybe you cause a little bit of stress inside the bone itself from that high tension wire. And so you have to follow it with x-rays over time and make sure that you're not having something else happen. But generally speaking, that hasn't happened on a regular basis.
I'm intrigued because as an orthopedic surgeon, I find it fascinating because you're not only stabilizing the injury at the time that you're doing the surgery, you also have to assess and understand what that joint needs to do in the future. And when you talk about the ankle joint, it is a fascinating joint. We call it a mortise joint. That those bones, that fibula and tibia, at the end of those bones, it forms kind of a hood over that bone in the ankle we call the talus. So when you're putting that back together, how do you assess how much space, because you don't want to get it too tight because that talus needs to move. How do you assess that dimensions and those mechanics? That's got to be something you got to think about as a surgeon.
Yeah, it's a pretty complex area. That talus bone is wider towards the front and thinner towards the back.
Right.
So that's why those two bones have to move a little bit, because when your ankle comes up, you lift your toes to your head, you need to have more space between those two bones. Otherwise, you'll lose that ability to move it normally. So usually, at a minimum, you're checking that with x-rays. You're looking at it while you're doing it and putting the foot in different positions to assess how those bones sit. And then if you're really concerned about it, you actually can open up the front part of the ankle joint to look at that junction, which we call the mortise,
right?
To actually see how those bones align and to see how the fibula and the tibia kind of fit together.
A lot of times with these injuries, because sometimes they can be violent, this is a torsion injury, and that talus sometimes pops around there a little bit. Do you ever find cartilage damage on that talus, on the hood of that talus or the top of that talus, or those distal fibula tib? Is there cartilage damage or fractures that you ever see when you go in there?
Yeah, and that's a big part of checking out those x-rays in the beginning, because obviously you can sometimes assess that. You'll see a small defect or small little lucency on the x-ray. But it is not uncommon to have small injuries up there. I always tell patients with regards to articular cartilage injuries, think of it like potholes. You can have really tiny little potholes that you drive over with no problem. And then you can have potholes that, if you go into them, your tire has a big injury. So when somebody has these injuries, if it truly has been dislocated, then you really have to look closely for those. Otherwise, we generally see how patients do. If they heal and they're not having any sort of stiffness, residual swelling issues, then you have less suspicion that there's been a major cartilage injury there.
Yeah, fascinating stuff. I mean, everything you have to look at and consider. Again, it's not just the time of the surgery. You're looking at 5, 10, 20 years. This is a quality of life decision sometimes when you're in there. How do you, just out of curiosity, you're kind of an athlete. I mean, how do you stay prepared for these decisions and everything you do in the OR? Dexterity, hand-eye coordination. I mean, do you do anything? Are you a woodworker? What do you do as hobbies? I mean, just to kind of stay in shape.
Yeah, some of it's, I don't have a hobby that focuses on my surgical skills. I'd love to say I do. I think mentally you have to stay on top of things. You basically have to take the time. In our academy, we have a lot of courses that we go to.
Yeah.
We stay involved in education and teaching. And so those are the things that help us out. In my own practice, I have Dr. Dugella, who's a wonderful foot and ankle surgeon who teaches nationally and internationally. So in this specific situation, I've got great resources with someone like that if we had an injury like this, we talk together about it and we figure out what the best plan is for that athlete.
Yeah, I've been in the OR watching you surgeons perform, and it's fascinating. I mean, it really is the skill and what you folks can do. I mean, I'm always amazed. And then I've seen some of the traumatic injuries that some of these athletes sustain, and what you do in the OR to get these athletes and other just folks back to function. Just amazing stuff. So, yeah, I always enjoy watching and talking to you folks because you do some great work. work. Here we go. We got a different injury here. Finally, we don't have a high ankle sprain. How about that? We have an oblique injury. Miles Boykin, Pittsburgh Steelers wide receiver. Obliques, man, that sounds painful just thinking about it, what I know about the obliques. Tell us about that.
Yeah, so that's something that essentially involves your abdominal wall.
Mm-hmm. Yes.
So you sort of have layers of muscle there that cross in different angles. So think of it kind of like the shape or the design of the British flag with sort of vertical,
right,
horizontal, and diagonal stripes. And so the obliques are those diagonal portions. They're very important for maintaining your core, mm-hmm, maintaining your ability to kind of turn in the air to catch a ball. So with a wide receiver, that's a very important place to have control. Unfortunately, with an injury like that, I don't think he's high on their depth chart, and they're not having a great year. So I think he'll be a sit this week. And again, that's a typical soft tissue injury that's going to just take, mm-hmm, time to heal.
Yep. I mean, if you've ever had an abdominal strain, I mean, it follows you with every movement, every activity that you make. I mean, it's your core. You can't function without your core. So he's a sit. Miles Boykin is a sit. Kyle Pitts, here we got MCL sprain, grade 2. Atlanta Falcons, tight end. You know, grade 2 sprain, that's pretty hard to get back to right away anyway.
Yeah, and the interesting thing in him, I mean, he's one of those freaks of nature. He's basically a hybrid tight end.
Right.
Kind of like an ultra fast tight end, not a big blocking guy, and they've relied a lot on him for their offense. He was able to walk off the field. He was very ginger with it. But the interesting thing is he's getting a second opinion now with the question of would he do any surgery on it. So that's very interesting with an MCL. Generally, we see those being just sort of treated with time and rest and healing. So I think the concern is that maybe he has a little bit of an injury slightly deeper.
Oh.
So beneath the MCL is your meniscus.
Right.
And that attaches in that area. So I think it may be a situation where they're perhaps a little worried that maybe there's something there that won't heal as well or as quickly without it being fixed or supported. There's some newer work being done similar to the high ankle sprain where some doctors are espousing the use of sort of an internal brace, essentially a suture overlying a soft tissue injury like this, like your MCL, to sort of brace that while it heals and doing it in a minimally invasive fashion. So I'm thinking perhaps that's been suggested to him, and he's going to get a second opinion to see if people feel strongly about that. The data is not really super strong to say that is definitely indicated. So I think it'll be interesting to hear in the next couple of days whether he goes in that direction. That being said, he won't be playing, and they're actually talking about him being done for the season. So he's definitely going to be a sit.
Yeah, that sounds very accurate. That's interesting that they're actually thinking about providing an external suture on that MCL to stabilize it. We'll have to keep an eye on that technique, but he's out, and good chance he's out for the season. Let's just update here on Kyler Murray. He's got a hamstring strain. He's been out the last 2 games, didn't play on Monday night. You know, is he on his way back? I mean, it sounds like they kind of need him. I mean,
he's one of those ones that I think they made a decision this past week based upon the type of player he is. He relies a lot on scrambling. He's kind of like Justin Fields, and he apparently was actually participating pretty well in practice, but they had 4 offensive linemen of their regular linemen out for their game this past week. So they kind of knew whoever was back there was going to be running around. So they figured that should be Colt McCoy instead of him. Poor guy. Still looks like he's 12 years old.
I know. Oh, he's been 13 years in the league. Can you imagine? It was just yesterday he came out of Texas, if I remember right. So.
Yeah. And I literally saw him coming off the field in his helmet, and I thought, geez, they took a guy out of the Pop Warner League to play. He looks so young. But anyway, so I think Murray will be playing this week. I think you can play him because I think they just were giving him one more week to heal up from that sort of nagging hamstring injury for a guy guy who scrambles.
Yeah. Kyler Murray is a play this week, week 12. Well, that's our list of injuries. We have a lot of high ankle sprains. We had a new one, an oblique. We have a AC separation, a non-throwing injury, and kind of a nagging hamstring strain here with Kyler Murray. But he's going to play. Dr. Hawkins, thank you so much again. Wonderful information. Great job. And wishing you and your family a happy Thanksgiving. And everybody out there, happy Thanksgiving. We'll see you next week.
Sounds good, Shannon. And make sure if you can get a turducken, get a turducken.
I always do.
All right.
All right. See ya. Bye-bye.